Our presenter today is Kelly Fountain and along with her, Jessica Elliott. And they are advisors with the Kentucky Regional Extension Center for the Quality Improvement team. Kelly is our lead quality team advisor, and she's been with the Kentucky REC for over 6.5 years. She works with practices in developing and implementing strategic plans for process improvement, practice innovation, and quality improvement projects, such as alternative payment models, quality and value-based care programs. Jessica is a practice transformation and quality improvement advisor with 14 years in healthcare, the last few of them here with us at the Kentucky Regional Extension Center. She advises healthcare leaders on enhancing performance and value-based care models. And Jessica also provides guidance on quality improvement implementation within practices to improve patient outcomes and drive clinical excellence. As before, please enter any questions you have in the chat box. And if we have time, Kelly and Jessica will answer them at the end of this session. If not, we'll save them and share them with the quality improvement team to answer directly afterwards. Take it away.
Some pointers that we want to share with you all to really help lay that foundation for your performance and your success for the quality payment program for 2021. And so I'll be reviewing some need to know tips for eligibility, and Kelly will be walking you through some of the things that you can start doing now at the end of the year as we're closing out this calendar year, and what you can start doing in early 2021 to really lay that foundation for your performance and success around those four performance categories. And then we'll transition over into how our services can help support you all in that journey, and then some questions. All right, so digging into eligibility for 2021. The first thing that we're going to actually lead off with is a poll. All righty, so if we want to go ahead and get that launched, the first question is, do you know where to check your MIPS eligibility? So simple yes or no. We're going to get that launched here in just a moment. There we go. We'll give you a couple moments to fill that out. And so there's a couple different places that you can actually find your eligibility. And there's also a couple times during the year that you want to take a look and fill out your eligibility, and to monitor your eligibility as well too. And we'll talk about that here in just a moment. All right, and if it looks like we've got enough responses, we'll go ahead and move on. Thank you very much. So now for eligibility, as far as that goes, so there haven't been, and I'm not sure if I missed the part of the introduction when I blipped out for you for a second there, but we did have the final rule drop for 2021 on December 1st. So we are peppering in a little bit of information and updating information around the changes to that final rule for 2021 in this presentation. We will have a more in-depth final rule in December and January, more information on that later on in this presentation as well too. But there haven't been any real updates to eligibility for this next program year. So big sigh of relief. All of the eligible commission types are still the same that they have been. And there's still two main tracks in which you can participate in the program. So for today, we're just going to focus on the MIPS track, but there is the MIPS track and then there's the APM track. So your eligibility for MIPS, again, you have to meet the low volume threshold in those three different areas. So you have to have at least $90,000 in Part B billing for Medicare, plus you have to have at least 200 Medicare patients, and you have to have at least 200 covered professional services. So you have to meet that threshold across all three of those areas in order to be able to fully participate in that MIPS track. Now, the other track, the APM track, just to remind you about the thresholds for that, in order to even be able to participate as a part of that APM track, you need to be part of a CMS deemed APM, advanced alternative payment model. And you need to have a contractual agreement, and that has to be functioning within the performance year to be able to even have that foundation of being a potential participant in a MIPS AP or in the APM track. Plus, in addition to that, you have to meet certain thresholds. So you have to have at least 75% of your payments processed through that APM, or you have to have at least 50% of your Medicare patients tied to that payment model in order to participate in that advanced APM track. And that, again, that advanced APM track is that 5% lump sum bonus. And you don't have to participate in the MIPS track if you fall into that APM track, nor are you scored on cost. Okay. So what can you do for eligibility now, and what can you do early on next year to really help lay that foundation? Well, the first thing that I always suggest is to know who the clinicians are that are tied to your TIN. And the best way to do that is actually to go into, as we talked about in that the poll, is you can actually go one of two pathways. You can go through your QPP login through the portal. So you can use your HARP account and you can go into your portal access. You can click on the TINs that are tied to your access, and you can view eligibility and to see all of the clinicians that are tied to that particular TIN. And then additionally, you can also go through qpp.cms.gov, and you can click on the participation checklist tool. And so you can look in that in the participation lookup tool, and that'll be able to tell you if you have the MPI number. You'll be able to pull that up and to search by the individual MPI as well if you don't have the HARP account. However, you want to look in that QPP portal first. Really is the best way to see who's connected to you, who the QPP program says is connected to your TIN. You want to verify and make sure that all the TINs that are participating in your organization that you are connected to, and those clinicians that are connected underneath them. And if you have any changes that you need to make those through PACOS. So the hierarchy starts out with PACOS, and then those changes trickle down through to the QPP portal. And so it can take a little bit of time. There is a little bit of a delay from whenever you submit your changes in PACOS to whenever you'd actually see them whenever you log into the portal. So just be aware of that. Now, to set yourself up for success, and some of the things that you can do early on in 2021 is that you want to make sure that you are checking and reviewing your eligibility early. The first initial snapshot is usually finalized around April. And so it'll be in April of 2021, so in the springtime. And you'll want to check and look to see your clinicians who are tied to your TIN, at what level do they meet the thresholds, right? The low volume thresholds of Part B billing, professional services, and Medicare patients, because they can be eligible at the individual clinician level, they could be eligible at the group level, or they could be something that's opt-in eligible. Opt-in eligible means that they don't satisfy all three of the low volume threshold, but they maybe meet one or two of those, and so that you can opt in to submit for the program. And so you want to take a look and see, what's going to work for you, what your clinicians are eligible, how they're eligible to participate. And then that really lays the foundation for how you're going to be able to track and look at your data and prepare for each of the performance categories moving forward throughout the rest of the year. Now, transitioning over to those performance categories, where Kelly is going to walk you through some of the things that you can do to help set yourself up for success. Kelly?
All right, awesome. Thank you, Jessica. So let's go ahead and start with promoting interoperability. Now, remember, we're talking about program year 2021. So we're thinking about next year. We're not necessarily focusing on what you can do this year. And as Jessica mentioned, the final rule did drop earlier last week. So December 1st, CMS did release the final rule, and it did have impacts on 2020 and 2021 program year. We will be hosting 2 webinars in the next couple weeks to kind of highlight all of the in-depth detailed changes to the program for 2020 and 2021. So stay tuned for that. Now, for 2021, you're really looking at still for promoting interoperability, wanting to get at least 100 raw points. And that, of course, will get you the full credit for this category, which is 25 points towards your final score in the MIPS performance. It does still require 90 consecutive days. And I do want to draw your attention to the fact that there are still 4 objectives, but 7 measures. CMS is adding in an additional measure as proposed. There are 3 attestation requirements, and there are still exclusions and exceptions available for you. So we'll go ahead and go on to the next slide. Now let's talk about what we can do now and what we can do early in 2021 for your 2021 performance. So one thing that we have found across the state and even outside of the state is that a lot of practices struggle with health information exchange. This is a major objective in this performance category. So anything that you can do now to help strengthen your performance moving forward is ideal. So we'd like to start with identifying your referral patterns, right? So seeing, do you receive a lot of transitions into your care, or are you primarily sending people out of your care? Or are you kind of one of those in between where you receive both and send as well? You want to identify the workflows, see who your most top 5 or 10 referring partners are. The reason you want to do this is you want to identify any potential barriers to doing transitions of care electronically. And you want to kind of back all the way into it. So going back to what Mary talked about this morning, and then Brent as well, about data validation, you're going to want to apply that same thing to health information exchange. You're going to want to break down each of the steps that are necessary for you to meet this objective and subset measures within your system. If you can do it now, it will help set you up for success for early 2021. You really don't want to wait until the last 90 days of 2021 to capture your performance data. Ideally, if you can knock it out in the first quarter or the second quarter, that's even better. That gives you one less thing that you have to stress about. Now, I also want to call out the fact that Kentucky Health Information Exchange can help with this measure significantly. And if you can start that conversation now, you may be able to be up and running, or at least have some of the functionalities going by early 2021. So look at your reports now for 2020, see where your areas of opportunity around health information exchange are, and then apply those lessons for 2021. So start early. Go ahead and pull your reports for 2021 as soon as they are available. Don't wait until mid-year to pull your promoting interoperability reports. These objectives and measures require you to monitor them in order to really drive improvements. Don't just stop at face value. Dig into the data. See what it's telling you. Are you really getting credit for every electronic transition of care you're doing or receiving? Is there a way to make it easier to incorporate into your system so that it makes it easier to do the right thing, to get credit for what you're doing? Of course, take a look at driving strategic quality improvement across the board. So if you want to start with health information exchange, that's typically a good place to start because it does carry so much of the weight for this performance category. And there are flexibilities around whether or not you shift the weights for send, receive, or even that new measure in particular. Ultimately, start reviewing data early if you can. So we'll go ahead and go on to the next slide. So let's talk about quality. Okay, so first thing, let's just go ahead and get it out of the way. CMS did adjust the weight for this performance category. Now, they've been threatening to do this for a while now, and they actually have. So starting in 2021, the performance weight for quality will be 40 points. Now, remember, throughout the transitional period, CMS has the flexibility to adjust these performance weights. So we are nearing the end of that transitional period. And so we really just have a couple more years before cost and quality are mandated by law to be balanced at 30 and 30. So for this year, we're looking at 40% weight. Now, you still really want to target at least 60 raw points in this performance category, and it still requires 365 days worth of data. Now, ideally, we recommend that you submit or at least monitor more than 6 measures. However, CMS does mandate at least 6 measures with at least one high priority or outcome measure. And remember, all of these measures you're submitting on, you're being evaluated on a 10-point scale, where typically your score will be anywhere from 3 points to 10 points, assuming that you meet the data completeness criteria and or the minimum threshold. As a reminder, that minimum threshold is 20 cases in your denominator, and you still have bonus points available for this. In particular, there's still the end-to-end electronic submission bonus points, as well as improvement scoring and additional high priority or outcome measures. So we'll go ahead and go on into what we can do now and what we can do early in 2021. Now, you may be thinking that this looks and feels very similar to promoting interoperability, and you're right. I'm glad that you're drinking your coffee this morning. So you really want to start with reviewing historical performance. Identify where you have a lot of patients in your denominator. Perhaps one provider is doing phenomenal in maintaining their diabetic patient population. So reflecting back onto our first session of the day. So how can we identify one provider that's doing fantastic on A1C pore control? So all of their patients, or a large percentage of their patients, are in control. What is that provider or that care team doing that's different than perhaps some of your other providers? Is there something that we can do to apply those lessons learned to the rest of the clinic? Or is there a way to modify your workflows to support and make it easier to do the right thing, easier to document in the right place? So start by identifying the positive is normally where I like to start with historical data. And then go for the next step, which is where are some areas of opportunity. Now, don't think of these as calling out the negative. It's not. It's looking at where can you drive improvement. Do you have a large patient population that you are working with for high blood pressure? And because of COVID, you're not getting them into the clinic as much. You're doing more telehealth. And as a result, you're seeing a decrease in your performance in controlling high blood pressure. What are some steps that you can do now to implement early in 2021 to really help those patients manage their high blood pressure, so that not only are you improving your performance on this measure or on this performance category, but you're actually driving improvements in that patient outcome? Ultimately, you want to identify gaps for improvement. You want to call those out. Identify prior to January 1st of 2021, what measures you think you want to review and work on for 2021. Of course, CMS does release those updated spec sheets. So when you're thinking about what to do early in 2021, you really want to own your data. You want to know the ins and the outs. You're going to want to dig and do data validation on every single measure that you're planning on reporting on, so that you know what goes into the numerator, what goes into the denominator, what falls in those exclusions and those exceptions. And then once you know your data is accurate and correct, you want to see, okay, how can I drive targeted interventions or improvements, do a PDSA to improve the patient outcomes for that measure, whatever measure it may be that you're looking at. So we'll go ahead and go on into cost. Now, cost is everybody's least favorite category, mine included. So this, of course, there's not a huge number of changes for 2021. Biggest, though, is that it's 20% of your weight, 20%. So we went up, and we're going to continue to go up here. So it's going to continue to become a larger percentage of your final score. This program is a numbers-based program, and I like to call that out because the closer you are to 100 out of a possible 100 points, the higher your positive or percentage of that positive payment adjustment will be. It does require 365 days. However, there's no action you have to take. This is purely based off of claims data. So think of this as your balancing measure for quality. You have direct control over what is submitted for your quality performance. However, you do not have direct control over what the claims tell for balancing out those quality measures. There are up to 20 measures that you could be evaluated on, and there are case minimums for each of those measures, as well as patient attribution methodologies for each of those measures. And again, this is one of the many reasons why most people do not enjoy this category, myself included. You are still evaluated up to 10 points per measure that you do qualify for. And you are evaluated against your peers. Okay, so let's think, what can we do now? And then what can we do early in 2021? So again, own your data. This is going to be the theme of every slide that I talk about, guys. So look at historical performance. As Jessica mentioned, you really want to get into that QPP portal, and you have to use your HARP credentials to do so. So if you don't have access, go ahead and set it up now. Please go ahead and start on it. Sometimes it takes a couple weeks to get it finalized. You want to identify the measures historically that CMS has evaluated you on, and then identify where are some areas of opportunity. What did you do well, and what could you improve? And then look at the measures for 2021. What are the potential measures? If everything holds true, how many measures do you think you'll be evaluated on cost? And then early 2021, identify a patient population that you want to help manage a little bit better. And this is really should be shaped by what you were evaluated on in 2020 and previous years. So you want to start small. You want to really identify a targeted patient population and use your data to drive improvements. If you're looking at colorectal cancer screening because you have a large patient population that is admitted into the hospital for gastric issues, for example, perhaps that might be a place to start. Start with doing FIT test or scheduling those colonoscopies for those that are really at a high risk. Start small. Look at one patient population and focus in on that. It's not going to have a direct impact. So you're not going to see your cost score go down daily because you have to wait until that feedback is released from CMS. But ultimately, it's all about driving improvements in patient outcomes, keeping your patients out of the emergency room and in your clinic where it's more appropriate and you know your patients. You do a better job of taking care of them. Okay. So we can go on to probably the lightest category, and this is improvement activities. No major changes here, guys. So it still is 15% of your final score. It requires 90 consecutive days or more. It still has the weights associated, medium and high, and they are impacted by special considerations or statuses, such as small, rural, HIPSA, non-patient facing. If you are doing group, 50% of that group needs to do the same activity. It doesn't have to be the same time frame. So let's go ahead and go into what you can do now and what you can do early in 2021. So what are you wanting to focus on for 2021? Think back to that patient population that you're wanting to monitor or drive targeted improvements on. What are some of those quality measures that you really want to focus on? Okay, so what are some improvement activities that support quality improvement in those measures or in that patient population? Make sure that you have a workflow identified and laid out before you start 2021 for those improvement activities. Pull the data validation sheet. Please make sure you know what CMS is really intending with that activity. There's typically no report you can pull for this, so make sure your documentation is strong. Now, when you're starting early 2021, which is hard to believe, try to align it across the other performance categories if you can. Make it so that the activity you're doing counts, has the biggest bang for your buck, if you will. Make sure you know how and when you're going to do your documentation, capturing those screenshots, and who is going to own that process. Ultimately, this one's all about planning and then just implementing pretty early on in the year so that you have flexibility. All right. So at this point in time, I'm going to transition back over to Jessica.
All right. Thank you so much. We will go ahead and I want to talk to you just very briefly about navigating the QPP timeline. So, and how we can help support you all. Well, and as I mentioned earlier in the presentation, there's different snapshots of eligibility, and eligibility is a very crucial first step that you need to do to ensure your success in the program. And so, one of the services that we offer here is to be able to help you to keep track and to help you monitor your eligibility around your clinicians that are tied to your TINs within your practice. Some of the other services that we offer, legislative updates, as Kelly and I both mentioned, the Quality Payment Program final rule has now recently been dropped, and we like to spare you having to read 2,000 plus pages of legislation, and we like to distill that down for you, give you all the highlights, the need to know facts, and then also to help you incorporate that into your practice so that you can successfully participate in the program to maximize your incentive payments and to definitely avoid any type of negative payment adjustment from that. We also stay apprised of any type of special impacts that come out, such as the COVID-19 updates and any type of hardship exceptions, and work with our practices specifically to help them identify what hardship exceptions and applications that they need to submit that will help strategically align with their practice and their goals. And we also offer support around performance feedback as well throughout the year. And we also help with that targeted review process. If there is something that perhaps hasn't been calculated correctly, we help you keep an eye on that and help you through that journey with CMS as well. So please feel free, and thank you. Please feel free to reach out to us. We want to help you dive into your data. As both Brent spoke about and Mary spoke about as well too, we help get into your numerators and denominators to help you dive into your data, to validate your information, to validate your reports and your documentation, your workflows. We also look at where your gaps lie and help perform a gap analysis, resulting in an action plan that's tailored to your practice. And we follow throughout the entirety of our contracts with you on where you're at and the best practices that you can help implement to help close those gaps. And as we've alluded to before, not only do you have just one advisor assigned to you, you have a whole host of resources within the REC at your disposal when you're working with us. You know, our goal is to help you succeed and to truly reach your potential, because we know that the quality payment program is one of many, many, many things that are occupying your day. And so we want to take some of that burden off of you so that you can focus on your patients and patient care, and then not having to worry about reading the fine print of 2,000 pages to make sure that you're submitting things correctly. We want to make sure that we can help take some of that off of your shoulders. And so again, just whenever you are one of our clients, you do have exclusive access to webinars. I'll talk more about that on the next slide. You also have exclusive access to one-pagers and tip sheets. We also provide at the elbow attestation prep and support for you, as well as long-term audit support. You can be audited by CMS 6 years after your attestation. So we are there for you through the long haul as well too. And that brings me to our next slide. We do have our next webinar is on December 18th. It is our client exclusive QPP final rule first look. And so this is for our clients only. However, we will be running a version of this webinar in January. If you want to flip to that next slide, this is a sneak peek of some of the information and content that we have coming up over the next couple months. And so for those folks who are unable to attend that December event, we do have information that will be shared on January 27th, how you get access to our webinars and know when our events and resources are available. You can go to the KentuckyREC.com website. We have blog posts, we have email blasts that you can sign up for any of our free webinars or answer any of questions you have. You can reach out and contact us through that information as well. And I believe we do have another poll question if we want to pull that up. I want to see if there's any outstanding educational content that you would like to see from us, if there's any one or particular category that has tripped you up that you would like to see some more concentrated education around. We definitely want to make sure that in the coming year, we really focus and dig in to what is important to you. So please let us know. And if you have some other idea outside of the 4 performance categories that you would really like us to deep dive into, please feel free to click other and submit that into the chat box below. So we'll give you another couple seconds to key in your answers for that. And in the meantime, we can go ahead and I'm not sure if we have any time for questions or if we have run out of time. Catherine, how are we doing?
Well, I have one question I'd like us to address, and that is someone wrote in, what license does a nutritional specialist need to be considered an eligible clinician?
Sure. So you would need to have a CNS or a certified nutrition specialist. Um, so it would just be a board certified license within that field.
Okay, great. Thank you. We do have some other questions, but we've run out of time and we will contact you directly to answer those. I really appreciate it. Thank you so much, Jessica and Kelly, for sharing this important information on the quality payment program. And as we've said before, feel free to contact us with any questions that you have. Our phone number or our email in the red box below.